So today I want to talk to you a little bit about trigeminal neuralgia, otherwise known as the suicide disease. And if you've been searching for information for help on trigeminal neuralgia, you probably know why it's called the suicide disease. It's the worst pain known to man, from what I understand. I've had hundreds of patients with it, and it's been described to me as an ice pick stabbing you in the face, as if chewing on aluminum foil, electric shocks. I mean, nasty stuff, right? Well, what is trigeminal neuralgia? Well, first of all, the trigeminal nerve is the fifth cranial nerve, okay? And it innervates the face. 3 branches, one across the forehead, one across the cheek, one across the chin. And what it does is it sends a sensation to the brain of some sort of a really severe pain. Now, most people, if you have trigeminal neuralgia, you've probably tried medications, maybe even had surgeries, and from what I understand, neither one of them are really very effective because, for one, you don't have a drug deficiency that's causing it. You don't have too many body parts. So those aren't going to fix it because the cause of your TN or your trigeminal neuralgia isn't a medical problem. That's not the cause. So what we've done is we've looked deeper into the trigeminal nerve and the trigeminal problems, and because it is a nerve that comes off of the brain stem, which let me show you my model. And so this is the head, the first bone in the neck, second bone in the neck. Inside here obviously is the brain. The brain stem comes down to the bottom of the second bone, then it's spinal cord. Well, the trigeminal nerve is the fifth cranial nerve that comes directly off the brain stem. It goes back up into the head and then comes out and innervates the face, right, into the 3 branches. Well, if one of these bones here has gotten a little bit out of a line and is actually interfering with the messages, when it leaves the face and goes down the nerve, it's unimpeded, it's normal, and sends a message to the brain that says normal, right? There's no pain. But if right here where the nerve comes into the brainstem, if that message gets interfered with, then it can alter the sensation or give a different sensation to the brain. What is that altered sensation? Well, I don't know. Could be ice pick, could be aluminum foil, could be shocking. We know, one thing we know, it can be pain, right? So if the message here is where it's misaligned, if we can find that, and if we can now realign it and now take the pressure off the brainstem so that there's no longer an interference or an alteration of that message, then, then the message leaves the face as normal, gets to the brain as normal, and there's no pain. Crazy, right? How one little bone could be out of line enough to interfere with the message from the brain to the brain so that by the time the brain gets it, it's changed and it's been giving you this pain, this shocking, this, ice pack stabbing pain for so long. I've had hundreds of trigeminal neuralgia patients that we've been able to find this and remove this and normalize those messages so the pain's gone that easily. Right? So now what we do as upper cervical doctors is we check to see if there could be a misalignment up here that could be interfering with the messages that could be creating the pain that you have in the form of trigeminal neuralgia. If there is, and if we can correct it, then we have found that the pain goes away without drugs, without surgery. If you live in the Charlotte area, call the number on your screen. We'd be happy to bring you in for a free consultation. We never charge for a consultation to find out what your needs are and to determine whether we think we can help you. If we can, we're going to explain to you what we need to do. If we can't, we'll at least know that. Then we'll try to find somebody else that we think can help you. Got nothing to lose. If you don't live in the Charlotte area, try to find an upper cervical doctor near you and go in and let them check and see if that could be the cause of your trigeminal neuralgia. If it is, I think it'll change your life. Thank you for tuning in. I hope this changes your direction in life and can actually help you finally get the help that you've been looking for. Look forward to seeing you soon. Thanks for tuning in.